Okay, let's spend some time today talking about Medicare for All. Medicare for All is becoming a bigger and bigger part of the 2020 Democratic primary. It rightly so. I mean, it makes sense. This is one of the biggest issues. How are we going to pay for healthcare? How are we going to organize healthcare? And there are now lots of inaccurate things that are being said about Medicare for All proposals. And there is lots of inaccuracy also about allegations about the positions of different candidates around Medicare for All. So what I want to do today, and I hope that this will be useful and understood in the good faith that I'm presenting it, I want to go through the bad arguments against Medicare for All, but I also want to bring up the more serious and sober critiques that are the areas in which we should be focused, because these are the stronger criticisms of the proposal. So to set the stage generally, if you're already triggered because I might say something about Medicare for All is not perfect, you've got to come back to the real world. There is no political proposal that is perfect or without caveat or risks or liabilities. This is the world we live in. Everything has the other side of the ledger. Everything is risk versus reward. Everything is opportunity versus liability. And what we want to figure out is what proposal or plan is on balance the best and most efficient when it comes to healthcare for delivering the best and highest quality and most available care at the lowest cost. We shouldn't be afraid in serious adult conversations about discussing the pros and cons of any policy, even a policy that we think is the best one or better than the status quo. And in fact, I would make a further argument. We need to be prepared for when people argue against Medicare for All. We need to be able to identify these are the serious arguments to be discussed versus these are the silly, bad faith, ignorant arguments that aren't really worthy of further exploration. My prediction is that most of my audience understands why I'm doing this and will like it and appreciate it. But I do know that there are people who will attack me merely for talking about, here are question marks that remain about Medicare for All, which completely misses the point. So first and foremost, bad critiques of Medicare for All. There are many of these. One that comes up often is the countries that have programs like Medicare for All have small populations. The US is huge, therefore Medicare for All wouldn't work in the United States. This is a bad critique of Medicare for All. Number one, bigger population actually means that you're spreading the risk across more people. There's no one small group or people with a particular condition that can throw off the actuarial realities of what it costs to cover people. You can make the opposite case, that actually the bigger the risk pool, the safer and more efficient and better priced something like Medicare for All would be. That's a bad argument. Now, secondly, you can also disprove that by counterexample, because there are many very large countries that have nationalized systems of different kinds. Germany has 83 million people. Their system is not Medicare for All, but it is a system that is far better than the one we have and has elements of Medicare for All. Japan has 130 million people. I think you get the point. Now, that being said, you can make the case that what will make the US implementation more of a struggle or a challenge are the large rural areas of the United States, because large rural areas can be more of a concern in terms of providing access to healthcare services. But that's not an issue with Medicare for All specifically. That's an issue more broadly in a country that has a lot of rural areas, and it has nothing to do with Medicare for All. Second bad argument that we hear about Medicare for All. Medicare for All will lead to long waits for services, and it'll lead to rationing of care. And, death panels was one of the phrases that used to be thrown around. We already have those things. There is a shortage of dermatologists in much of the US. You sometimes have to wait 3 or 4 months as a new patient to see a dermatologist in all but what would be considered like emergency. You might have skin cancer, it needs to be looked at right now. There's already rationing in our system because for-profit insurance companies are deciding who's covered, what is covered, when and how much. You can already see de facto rationing, and it impacts how people obtain or avail themselves of care that they would like to have. There will sometimes be waits, and there will sometimes be rationing under Medicare for All. It will be different than under the current system, but it's not unique to Medicare for All, and it is not a unique criticism of Medicare for All whatsoever. Then you get into the general, we can't afford it. That's a terrible criticism because we can't afford our current system if the barometer for affordability is people can get the care that would be medically suggested at a price they can afford. We already have a problem with affordability. Affording Medicare for all is a question of political will. It's a question of deciding what kind of a system are we going to have and deciding to put in the means to pay for it. Now, there are also, we'll talk more about cost in a moment. There are also just really dumb criticisms of Medicare for all, like it's communism. These aren't remotely serious. I'm not even going to waste your time with that today, but just know that if you hear those words in a critique of Medicare for all, it's not a serious critique. So let's now get to what are the more important and sensible critiques of Medicare for all. We all want to know what these are so that we can be prepared. Seriously, I hope people understand what I'm doing here. I'm not attacking Medicare for all. Despite the following critiques, it may still be the best system, but this is how serious people evaluate important proposals. We figure out what are the strongest arguments against it, and then can we still defend this as the best policy in light of those arguments? Does it stand up to scrutiny as remaining the best plan? First of all, just accepting that Medicare for all isn't the only way to get to universal coverage, we should all be doing. This isn't a criticism, okay? It's a reality. Lots of countries have universal coverage that people can afford without Medicare for all or something that would be equivalent in that country, but with other plans. I've talked about many of them. Medicare for all could still be the best, could still be the simplest, it could be the cleanest, or not, but it's important not to say that Medicare for all is the only way to achieve healthcare for everyone, because there are many examples from around the world that are different. Second, the idea that costs will go down for everyone or almost everyone, that is a possible truth. It is possible that you can structure Medicare for all so that costs goes down for most people. But if you look at serious analyses, you will see that in order for costs to go down for most people, you need either to justify drastically reducing what healthcare costs per person in the United States beyond just what the bureaucracy adds to the cost. I'll get to that momentarily. Or you need a more modest plan in terms of what's covered. And I'll explain that. Now, this is not my opinion. If you look at the work of the Urban Institute, which is left-leaning, they say that to do exactly what Bernie wants to do, overall healthcare spending might actually go up. I'm just the messenger here. If you do what Bernie wants to do in terms of taxation level, but with more modest covered benefits, then the cost might go down for most people. Now, this is not an attack. Let's be adults. No system is perfect. There are many ways to set up a plan. There are left-leaning analyses that say it is not as cut and dry as Bernie's numbers make it out to be. Now, that's okay. It might still be the best proposal we have, and it would definitely be better than what we have right now. But we're doing an analysis. So let's stick with this issue of cost for now. The argument is, right now, we have all these different costs. We've got employee-paid health insurance premiums, employer contributions to healthcare premiums at many employers. You've got your co-pays. Some people have co-insurance. You have an annual deductible you have to meet. There is a maximum yearly out-of-pocket. It all adds up. And the idea is Medicare for all gets rid of all of that stuff, and it gets replaced with a payroll tax that is shared by employees and employers, and overall, the cost comes down. This is, in total, a claim that has some controversy around it, even when you look at nonpartisan and even left-leaning economists. It's possible that that's the way it would work. It's not guaranteed, okay? There are dense economic papers, which I encourage you to read, from good economists, for example, Robert Poling from the University of Massachusetts, who has consulted for Bernie Sanders, who says the truth is we don't yet have all the details to say for sure that the middle class is definitely going to save. Let me again be clear. Costs might go up slightly. They would cover more. So it might still be a trade we want to make, and it still could be the best proposal for most people. But serious economists say it's a little early. We don't really have the data to say that costs are going to go down for almost everyone the way that Bernie and Warren and others have been saying. It's not an attack or a defense on any candidate. This is just the reality about these proposals. Let's do one more thing related to the cost piece. Bernie has said, you raise the money from an employee tax and an employer tax. The employer tax is only going to hit companies that have payrolls of 2 million or more per year. If you look at that, economists generally believe that that tax that the employers pay will be passed along to workers as either wage cuts or will delay future wage increases or will lead to companies maybe not hiring as many people. That doesn't mean it's a bad plan. That's something that economists say is not being accounted for in the broader economic impact of the proposals. That's a serious question. Now, again, this might still be the best plan, but we don't want to pretend that every question is answered by the proposals that we have so far. Now, there's one other detail. Bernie and Elizabeth Warren haven't made clear who counts as middle class. A big part of what they say is middle class total costs will go down. We need to know who counts as middle class in order to evaluate that. So far, we haven't gotten that. Doesn't mean anything's dishonest. Doesn't mean anything is untoward. But we need to know that. Next, aside from who pays, there's the issue of total cost, and this is what I alluded to earlier. There are left-wing economists, serious economists, who say proposals for Medicare for all are drastically understating the cost to deliver care. One example is an economist named Kenneth Thorpe. He was hired, remember when Vermont was going to do state single payer? He's not a right-wing bomb thrower. He was hired by Vermont to help implement state single payer, which ultimately didn't happen. Thorpe has said that as proposed, if we look at Bernie's 2016 Medicare for All plan, which is very similar to the one we have today, 71% of households overall who currently have private insurance might end up actually paying more in total when you account for the tax increases. Now, they may have better access. They may have more covered services. We still might want to do it, but the claim that everybody's costs will go down, this left-wing economist says there is a question mark around that. That's just one analysis, but it's an important one. And it's really important to understand where the discrepancy comes from. Thorpe says that Bernie's plan, the numbers Bernie uses, they change out, when they change out from a private insurance system to a single payer system, they assume that our per person healthcare spending will drop to the healthcare spending per person in countries like Canada and Australia. This is an assumption that may never happen and it could take a long time. What I mean by that is Canada spends 48% less per person than the United States on healthcare. Australia spends 56% less per person than in the United States. Part of that discrepancy is the bureaucracy built into the system that we have. And when you get a more efficient system for paying, like Medicare for All, there will be a savings. But there has not been a good answer to why are we assuming total costs will go down to what they are in Australia and Canada? Because there are many other reasons, including just how things are priced here in the United States, that will keep costs higher, and that throws the numbers of most of these Medicare for All proposals out of line. Now, you can make the case. Once it's a single-payer system, the government is going to be able to negotiate costs of all services all the way down to what Canada and Australia have. That is a bit optimistic by serious analyses. So that's a question mark. So does this mean Medicare for All is bad? No, it doesn't. Does this mean Medicare for All is worse than what we have now? Definitely not. It would be better. Does it mean we should abandon Medicare for All as a platform? Absolutely not, especially because, remember, a lot of Democrats already oppose it, and it's going to be a negotiation no matter what happens in November of 2020. But we need to understand the details because there are good faith questions about Medicare for All that smart people on the left are bringing up. And they're being brought up because we want the best system. We want to anticipate what arguments could be made against it. And we want to be able to distinguish bad arguments like the US has too many people for this to work, terrible argument, or it's communism, not even an argument, versus, listen, if you look at the cost assumptions in most of these proposals, they seem idealistic and potentially beyond what the facts support. That's the important thing here. And if we go through that, we might still decide Medicare for all is the best system, or we might say Medicare for all is a great system that has these problems, and here is another system, not the lame public option, but serious other ways of getting to universal coverage that have other issues but resolve some of the issues of Medicare for all. This is how we have to think through these serious problems, and I think that's why it's worth taking the time to go through it. Let me know what you think. I'm on Twitter at @dpakman. The show is on Twitter at David Pakman Show.